before moving on, any other questions about data?
Yeah, I do. How do you present your data? Because sometimes I don't really understand all those numbers.
Yeah, that's a good question. A lot of parents need a lot of visuals to understand the progress their child's making. And I actually do have an example. Caitlin here will pass it around to you guys. And if you don't mind, I'll keep moving on. But you guys just look at that, take a look at that, and we'll move on to the next slide. I have a little bit more on data. So again, the question was, how do you go about presenting data? So let me tell you guys a little bit more about that. So what we do, we like to describe the exact purposes of our treatment. So again, this is trying to decide what is intended to be, what needs to be achieved in our program. So that's what we're focusing on in the first step. Next, we like to describe exactly how treatment is conducted. So because we don't want you guys to be, like, if there's a secrecy about something or something's a mystery, we want to make sure everything's put out here for you guys to understand. And again, graphs and charts help a lot. And again, the consultants, as me and Caitlin are, will be there to help you. We also make sure we describe our treatment effects and how they're measured. So again, by collecting numerical values and numerical data. What we like to do is show before and after our data collection is we like to use independent, unbiased implementers, which would be us or our RBTs that we have on staff. And we also like to do follow-up data. And this is, again, to see if the client is maintaining their gains that they make during treatment, or if the client is improving, or they may be regressing back and doing worse than we intended. So this is a lot of things to take in, but data is very important, guys, and we just want to make sure, like, if you have any questions, keep them coming. If not, we'll move on. So any other questions about data?
Okay, does anybody have any other questions before we move on?
Yeah, she mentioned RBT. What is that particularly? Is that?
Oh, an RBT is a registered behavior technician. So kind of like how we're board certified behavior analysts. So we've gone through a master's level program in behavior analysis, and then we had to sit for a board exam and take this like huge test in order, and once we pass, we're board certified. So for a registered behavior technician, they have to have a certain amount of hours experience working in this type of field, and then they also take a test to certify them. So they have experience working with the children, they have experience running ABA therapy, because we like to hire behavior technicians that have experience in the type of field we work with.
Yeah.
And then every single RBT that we have is supervised by us. And like we said in that insurance, there was an insurance slide that said that the services had to be provided by a behavior analyst, and that is who we are, and we'll like overlook them, we'll come and watch them take data, make sure they're doing everything correctly. Okay, so moving on to treatment evaluation. So evaluation of the client includes assessing the pattern behaviors, establishing mutually agreed upon goals. So kind of what we mean by this is we would assess a baseline, and then we would ask the parents, the caregivers, whoever is in charge of the child, to come and meet with us at our office, and we would all sit down and talk about the data. We would go through it with you, explain it to you, and then we would talk about the different goals that we would want to see in 6 weeks. And then we would meet up after those 6 weeks, look at the goals, see if they're okay, and then we could continue on or cut some off. But then we would want to continue the goals after that for 3 to 4 months, because sometimes it does take a while with our treatment to actually show effects. And that's the thing, we do ask everyone participates in it, because if they're only getting the services from us 3 to 4 hours a week in the home, the parents have to be able to do it as well every single day.
Hey guys, any questions from that previous slide?
Nope.
All right, moving on. So, questions about a client. So there is a lot of questions that are asked for ABA treatment services. We just wanted to put just a gist of questions that maybe parents have. And so some that follow will be, what assessments do you use? How often are they updated? Another one would be, what are the qualifications of your direct care one-on-one staff? So with our RBTs and with the behavior consultants. How much will ABA treatment cost, which is a big question. Will there be a collaboration with other disciplines such as SLP or OT? And the cost, what is the cost of training materials and reinforcers included, if that's included in our treatment, which is also another big question parents want to know. And did we take children into the community for training opportunities? I think Caitlin mentioned that. So for some social skills training, you may take a kid, you may go to their school, see how they're doing, then take them out to a playground, again in a grocery store. It just depends on what the parent wants to do. And also another question would be, how long does treatment last? These, again, are all very frequent questions asked and very important questions asked, but what we like to say is all these questions will be answered when you come for a consultation with us. We will do our best, again, at delivering the best care and working to make these improvements happen in your child. So just remember, questions are going to be asked, and we'll do our best to answer them. But once you come, we'll do our best to answer these questions.
So K&J Take the Day, we are a company that will continue to focus on applying effective interventions to our clientele. Our therapists will provide the appropriate services that are molded for each individual child's different needs. Clients will receive different reinforcement through verbal and tangible rewards for meeting their own individual goals, and consultation will continue to be based on the cooperation of treatment and, as we're seeing results.
So again, guys, thank you so much for being a part of this meeting. We just want you to remember, real progress happens every day with effort from us that we serve at K&J Take the Day. So come see us.
I am going to hand out some more brochures, and I'm going to hand out some business cards to everyone. But I just want to let you know we are open Monday through Friday. Our hours are 9 a.m. to 7 p.m. And as we evolve, we are going to obviously expand our hours once we get more RBTs. We also don't just serve Waco, Texas. We serve other surrounding areas. We just want everyone to know that in case you weren't located exactly in Waco. Does anybody have any other questions?
No, thank you so much. That was a great presentation.
Thank you, guys. Thank you, everyone, for coming. I hope you bring your children.
Thank you, guys.